Hello everyone. Today we'll go through the general anesthetic theory part, the last part. Today, in continuation with the last video, we will start with the inhalation anesthetics. The inhalation anesthetic can be categorized into two parts. One is a non-halogenated gas, which is nitrous oxide, and the other is a halogenated hydrocarbons. That's halothane, enfuran, isofuran, desfuran, and etc. So the most important characteristics of inhalation anesthetics which governs anesthesia is one is the partial pressure of anesthetics, the pulmonary ventilation, alveolar exchange, which is very important, which depend upon the two things. One is the solubility in the blood and the solubility in the fat. The solubility in the blood is the blood gas partition coefficient, and in the fat or lipid is the oil gas partition coefficient. So concentrate on the blood solubility, which basically governs the gas partition coefficient. It is a measure of solubility in the blood. It determines the rate of induction and recovery of inhalation anesthetics. So the lower the blood gas coefficient, faster the induction and recovery. Example, nitrous oxide. Higher the blood gas coefficient, slower induction will be 2 and recovery will be very slow. Halothane example. So it is basically inversely proportional to the blood gas coefficient solubility and the blood solubility. The blood gas partition coefficient we have given here, that is the solubility factor. Now taken into account the oil gas partition coefficient. It is a measure of lipid solubility. Lipid solubility correlates strongly with the potency of the anesthetic. That is, higher the lipid solubility, more will be the potency of the anesthetics and more smooth induction will provide. Now is a very important term which we focused in the last video also, that is a MAC value. Minimum alveolar concentration is a important measure of inhalation anesthetics potency. It is defined as a minimum alveolar anesthetic concentration, that is a percentage of inspired air at which 50% of the patient does not respond to a surgical stimulus. It is defined as a minimal alveolar anesthetic concentration at which 50% of the patient does not respond to a surgical stimulus. MAC values are additives and lower in the presence of opioids. MAC values should be 1:1 to 1:2 during the surgery. Here is a general graph we have given for showing the oil gas partition coefficient. The second gas effect is one of the most important things which can be used for the non-halogenated compounds, like nitrous oxide is very insoluble in blood and other tissue. This results in rapid equilibration. The rapid uptake of N2O from alveolar gas serves to be concentrated and co-administered with the halogenated anesthetic. This effect is basically called the second gas effect, which speeds in the induction of anesthesia. Means that when we use a combination therapy in case of inhalation anesthetics, the second gas which we incorporate provide the second gas effect. Now the diffusional hypoxia. On discontinuation of N2O administration, nitrous oxide gas can diffuse from blood to alveoli, diluting oxygen in the lungs. This can produce an effect called diffusional hypoxia. To avoid hypoxia, 100% O2 should be administered when N2O is discontinued because to remove the hypoxia state. Now the inhalation anesthetics we will see something important characteristic of it, like nitrous oxide is the safest inhalation anesthetics, non-inflammable, non-irritating, low potency anesthetics, poor muscle relaxant but a good analgesic, no toxic effect on heart, liver and kidney. Ether, potent anesthetics, good analgesic, good muscle relaxant, irritant, inflammable, explosive, but it has a very slow induction and unpleasantable. Recovery is also very slow, so it is not used much. Halothane, potent anesthetic, poor analgesic, poor muscle relaxant. Induction is pleasant. It sensitizes the heart to catecholamines. It dilates bronchus. It inhibits uterine contraction. Halothane, hepatitis, and malignant hyperthermia can be occur due to the induction of it. Now the end-furan. Sweet and ethereal odor generally do not sensitize the heart to catecholamines. Seizures occurs at deeper level, but it causes renal failure due to the fluoride ion present in it, which is a very important thing. Isofluran, it is commonly used with oxygen nitrous oxide as a second gas. It doesn't sensitize the heart to catecholamines. Its pungency can irritate the respiratory system. Desfluran, it is delivered through special vaporizer. It is a popular anesthetics for daycare surgery. Induction and recovery is fast. Cognitive and motor impairment are short-lived. It irritates the air passages, producing cough and laryngeal spasm. Sevoflurane, induction and recovery is fast. It is pleasant and acceptable due to lack of pungency. It does not cause airway irritancy. Concern about nephrotoxicity is a very bad thing of it. Parenteral anesthetic, the other part. They are used for the induction of anesthesia, rapid onset of action. Recovery is mainly by redistribution. Also reduce the amount of inhalation anesthetics for maintenance. Example, thiopental, midazolam, propanol, ketamine, etc. This is a classification we have given along with the structural isopropyl phenol like propanol and phosprophonol, barbiturates, thiopental, benzodiazepines like diazepam, etc. And the others we have given, that phenylcyclidine as ketamine. We have given here the doses criteria and all of the things, the Vmax. Just have a look, just not that important, but given here. Parenteral anesthetics, the thiopental. It is an ultra short acting barbiturates. Consciousness regained within 10 to 20 minutes by redistribution to skeletal metals. It is eliminated slowly from the body by metabolism and produce hangover. It can be used for rapid control of seizure. Propanol, most commonly used IV anesthetic, unconsciousness in 45 seconds and lasts 15 minutes. Antiemetic in action, non-irritant to airways. Ketamine, dissociative anesthesia is produced, profound analgesia, mobility, amnesia, and with light sleep and all. Act by blocking NDMA receptor, which we focus on the first part of the video of theory. Heart rate and BP are elevated due to the sympathetic stimulation. Respiration is not depressed and reflexes are not completely abolished. Ketamine is also been used in emergency delirium. Is useful for burn dressing and trauma surgery. Dangerous for hypertensive and other patients. Dextromethorphan is also a few criteria. Tolerance and dependence can be developed. It is principally used for the shortening sedation of tracheally intubated and mechanically ventilated patients in an intensive care unit. General anesthesia induction agents. There is a dosing part we have given here. And the neuroleptic analgesia is characterized by calmness, psychic indifference, and intense analgesia without total loss of consciousness. and the other, it is associated with a decreased motor function, suppressed autonomic reflexes, cardiovascular severity with mild anesthesia. This is all total of the theoretical part of the second part of our video, general anesthesia. Thank you.